Hi everyone, and welcome to ERP Unboxing, a series where we explore how businesses can transform their operations through digitization. Today we're diving into the healthcare sector with a case study of ABC Medical Centre. In this episode, we explore how a hospital management system can improve their operations across multiple departments. I'll show you how this solution streamlines patient records, enhances both inpatient and outpatient management, simplifies clinical procedure tracking, integrates laboratory management, and ensures compliance with medical coding standards. But as we all know, a healthcare institution needs much more than just medical systems to operate efficiently. That's where ERP Next truly shines, offering comprehensive solutions built right into the system. You can track your finances using the accounts module, manage your staff's payroll, leave requests, and so much more within the HR module. Organize your purchases and place an approval workflow using the procurement module. You can also track and manage your stock and other supplies effectively using the stock module. Now let's dive into the video and see how ABC Medical Centre implemented these solutions to transform their operations. Alright, this is the interface you see when you first log into the system. On top, you have a few tabs that will take you to see the total patients that are within your medical center. You'll be able to see the inpatients that are admitted. So right now we only have one patient. If you take appointments, you'll be able to manage those appointments, as well as any appointments that need to be billed. All right, and the next tab here just shows us appointments. It's a graph to show you trends of how much people are booking appointments within your medical center. All right, so I want to walk you through a workflow of an outpatient, how ABC Medical Center is currently handling that workflow within ERP Next. So if we go into the patients tab, all right, let's add a new patient. First name, say Tinashe. Last name, Moyo. Gender, we're gonna select male. We can also add any other details that we'll need. If I edit full form, open this, I'll be able to take in as well as the medical history of the patient that's coming in. So this form is pretty comprehensive. Right now I just need the name and the gender. I can also add date of birth. Let's add that. Let's change the year to 2000, August 17. All right, now let's save this form and proceed with our workflow. So this workflow can be done on the front desk when the patient firstly walks into the clinic, and we're taking their details. Once that's done, they are sent to another desk to get their vitals collected by another nurse or another person. So then go to the dashboard. That person will have access to the system as well. Their role will be mainly to taking the vital signs. So we'll collect the vitals from this tab. So I need to add vitals for this patient. Once I collect the vitals, I can then just log in the details. So I need body temperature. I'm gonna say 37. Heart rate pulse, gonna say 68. Blood pressure 120 and 80. All right. Respiratory rate, let's say 18. I can also take in their height, their weight. Let's just take weight for now. Let's say they weigh 78 kgs. All right, then I proceed to save and submit this. All right. So from every point where we create forms within the medical center, we can also print out so that we can keep physical copies. So this would be the physical copy for the vital signs. It shows the patient, the date and time, the vital signs that were collected. All right. Now, once that's done, once the vitals are collected, the patient will then go into the doctor's room and proceed with the encounter. So the doctor will have a different tab. So they'll be using this patient encounter. So once the patient comes in, they'll just open the encounter page and create a new encounter. All right. As you can see, the details will be automatically pulled from the front desk that took in this patient. So it's Tinashen Moyo. All right. And this just selects the healthcare practitioner. So this will be the doctor that's seeing the patient. You can also see the department that they work within. So this is just a general practitioner. So during the encounter with the patient, once the doctor makes his observations, they can then log in the symptoms into the system. So for the symptoms, let's add chest congestion, mild fever, and persistent cough. And for the diagnosis, gonna add acute bronchitis. All right. Now, once that's done, we can get applicable treatment plans. So we can create treatment plans within the system so that we don't have to do data entry all the time. A patient comes in with, let's say, acute bronchitis. So whenever a patient comes in and they have acute bronchitis, we already have a treatment plan configured into the system, so you don't have to manually input the treatment details for that. So if we select this from the treatment plan and get items, we'll be able to see the medication that will be needed to treat this illness. All right, we also have the medication, the dosage, the period which the patient will take the medication in, as well as the dosage form. So all this is pre-configured for us. We also input the medical coding. So we use ICD-10. All right, code value for acute bronchitis is J20. All right, as you can see, it's automatically populated in the display field as well as the definition. All right, once that's done, the doctor will just have to save and submit this form. They can also print out this form as well to keep physical copies. The patient encounter form, it has all the details from the symptoms that they recorded, the diagnosis that they made. All right, as well as the code system that was used and the medication that was prescribed to this patient. And if you go back to the main menu, I want to register payment. So let's go to the billing and payments. So once this patient is discharged from the doctor's room and they come back to the front desk, let's say our medical center also has a pharmacy, would then bill them for this medication that were prescribed. So just use the sales invoice, create a new sales invoice. The details are automatically pulled. And in our items, this is items that were prescribed. They were prescribed paracetamol. They also prescribed. Let's go back and see the items that will be prescribed. Let's open the patient encounter. All right, the inhaler, paracetamol, and amoxicillin. All right, let's add our items now. So we need paracetamol and amoxicillin, as well as the inhaler. All right, and the total will be 29 for this invoice. And we just click save and submit. So this sales invoice is part of the accounting side, accounting module. So we'll be able to track the ledgers as well. Right now it shows that it's unpaid. So just gonna register the payment. If the patient is paying via cash, it's easy for us to just register the payment. So in the new payment entry, we've created a new payment entry. We're gonna add the mode of payment as cash. All right, and yeah, this is the sales invoice we created. We're gonna register payment for. Just gonna save and submit this. All right, also be able to see the ledger transactions for this. All right, so we got cash $29 from our customer Tinashe Moyo. All right, if we go back, we can also print out these forms as well. So the payment entry can also be printed out, as well as the sales invoice can be printed out as well. I want to go back and create another workflow. Now this is going to be for an inpatient type. So let's go back. All right. Let's add another patient. Add patient. First name. Just going to say John. Last name Moyo. Say Moyo again. All right. Gender is male. Date of birth. Let's change it to 1999. January 1st. All right, we can also add blood group, identification number. This is ID, as well as primary addresses. If I open the full form, I think I did for the first one. You can add more information as we need, and the medical history as well. I didn't save our patient. Let's just create it again. So it's John Moyo. Gender is male. Date of birth 1999, January 1st. So let's save and proceed. Let me just refresh this page. Now John Moyo is now active. All right, so we go to our dashboard and we go through the same workflow that we went through for the first patient. So we need to collect their vitals before they see the doctor. All right, blood pressure is 39. Body temperature is 38, 39. Blood pressure, say 119 and 79. All right, heart rate is 67. Respiratory rate is 18. All right, we're also gonna collect their weight. Let's say it's 89. And we save and proceed. All right, once these vital signs are collected, the patient can then go into the doctor's room and start the encounter. All right, so the doctor then go to the patient encounter, create a new encounter with this patient. All right, just select themselves as the healthcare practitioner for this. And once they make their observations during the encounter, they can log the symptoms into the system. Let's see, high fever, protracted cough, and shortness of breath. The diagnosis they made during the encounter, pneumonia. All right, and if you click the get applicable treatment plans, click this and select this. Get items. We'll be able to see the medications that's used to treat this type of disease. All right, if there are any procedures that need to be done for this diagnosis, they need to administer an IV for antibiotics. So the patient will need to be admitted into the clinic. So let's go over that workflow. So let's first save this and submit. Save and submit, then proceed. All right. So right now we need to schedule an admission. Medical departments automatically pulled from the details that we collected. Service unit type, it's gonna be inpatient. Expected length of stay is just gonna be 1 day. Treatment plan is from our pneumonia treatment plan. If the doctor needs to add any administration instructions to this, but they're already in our treatment plan for the IV administration, so we don't need to add any more details on this. So just gonna order the administration. The start date is today. Is it today? Yeah, it's today. Order administration. All right, now the patient is admitted into one of our rooms. I'll show you what it would look like in the overview tree. All right, so let's go back to the main menu. All right, so we need to add the medications that we prescribed for this patient. So let's add the inpatient medication order as well. The practitioner who prescribed this, the start date, they're starting today. All right, get from encounter. Tracy Moyo, we need John Moyo. So it's get from encounter. All right, as you see, the treatment is automatically pulled from the encounter. The IV drip that's needed. So let's save this and submit. And again, we can also print out this form, inpatient medication order. So let's say the nurse will be responsible for overseeing the stay of the patient, will also get this form and see the medication that needs to be administered to each patient. All right, now I need to continue with the admission of the patient. So let me go back to the main menu and go into the inpatient record. As you can see, its admission is scheduled. What I need to do is click the admit button, select a service unit. So these are the rooms that we have available. Let's use room number 2. They're gonna just be in for 1 day, so they'll be discharged to the following day. So let's admit this patient. All right, now the patient is admitted. The next thing that I'll need to do, once the patient needs to be discharged for the following day, I'll just go back to this inpatient record and schedule a discharge so that we'll know if we have available rooms. So let me show you how it currently looks like. If I go into the healthcare service unit, and open it. As you can see, for patient bed 1 and patient bed 2, they're currently occupied, and 3, 4, 5 are vacant, as well as the consultation room. All right, now I just need to register payment for the medication that was prescribed to John. So if I go into the sales invoice, firstly, let me just see the medication that was prescribed. So it's IV antibiotics, paracetamol, and azithromycin. All right, let's create a sales invoice. And then I'll need to create another one for the duration of their stay. So that one I'll create it when we discharge the patient. Right now, let's create one for the items that we prescribed for the medication. So there was paracetamol, and IV drip, IV antibiotics, as well as azithromycin. All right, let's save and create payment for this. Save and submit. And then register the payment. You can also charge them for the stay within this invoice, but I would like to create it separately. But it's an option to create the invoice with the item for the stay, the duration of the stay, as we charge for patients to stay inside our rooms. All right, let me save and submit this. All right, I can also see the ledgers for this transaction, where it came from. So this is useful for the accounting department. I'll not go into details for the accounting side. Let me dismiss this, but this is our accounting module. As you can see the total outgoing bills, total incoming payments. All right, it's pretty comprehensive for the accounting department. They have everything they will need. So let's go back to our healthcare module. All right, we've come to the end of this video. Thank you so much for watching, and if you'd want for me to implement the solution for your medical center, you can get in touch with me using the email below. Otherwise, thank you for watching, and I'll see you in the next video.